The fluorescent lights hummed their monotonous frequency as Margaret Walsh's hands moved through muscle memory that had nothing to do with nursing school. 2:04 in the morning. Mercy General's Trauma Bay. A patient named Corporal Hayes lying on the steel table with a chest wound that had stopped bleeding for one reason only: his heart had stopped doing the work. The on-call surgeon was 18 minutes out. Margaret was already moving. She didn't ask permission. Permission was a luxury for people who'd learned medicine from textbooks instead of applied it in the dark with mortars landing outside the tent. The scalpel was in her hand before the attending resident finished saying his first word of protest. She opened the chest wall in one fluid motion, the intercostal space between ribs 4 and 5, the blade singing through tissue with the precision of someone who'd closed wounds in men twice the size while the ground shook. Her burn-scarred forearms, pale under the surgical lights, moved with terrifying fluid precision. 1, 2, 3. Rib spread. The pericardium exposed. Her gloved hand slipped into the cavity and found the heart, still, grey, useless. She began direct cardiac massage. Hands that had held lives together in a foxhole now held one in this sterile room with its fluorescent glare and its shocked residents pressing backward, watching a night shift nurse do something that shouldn't be possible. The compression was rhythmic, controlled, the kind of control that comes from having already survived the worst. Squeeze. Release. Squeeze. Release. Blood pressure monitor ticking upward. 70. 75. 80. No one in the room breathed. Margaret had spent 3 years at Mercy General being exactly what she appeared to be, a competent night shift nurse with burned scars on her forearms and a quiet demeanor that discouraged questions. The scars came from a house fire in her file, or that's what anyone who bothered to read it would assume. No one ever asked. 3 years of 12-hour nights in a 47-bed hospital in Savannah, Georgia. 3 years of fluorescent lights and antiseptic that smelled like the future, and 3 years of being invisible in the way that only people who work the graveyard shift ever become invisible. The night shift was its own country, governed by its own laws. Day nurses ran on coffee and competition. Night nurses ran on something quieter. Necessity. Capability. The kind of competence that doesn't require anyone to watch. Margaret understood that. She'd been trained in it. The break room on the 3rd floor, the one with the vending machine that had been broken since 2019, the one where no administrator ever came, that was where she sat during her 20-minute lunch at 3 in the morning, surrounded by silence and the industrial hum of machinery that never stopped. Her locker was tucked into the corner, 3rd row, narrow door painted hospital beige. Inside, 2 extra uniforms folded with military precision, a pair of trauma shears with her initials engraved on the handle in lettering no one would ever see, and beneath the spare scrubs, a folded flag. The flag was the size of a closed fist when folded properly. She'd folded it herself, the night she received it. 16 names sewn into the fabric of the lining, each one stitched in silver thread. 16 people whose names she could still recite without thinking, the way most people could recite their address. She touched it once each shift, a moment that took 3 seconds and meant everything. No one ever asked about it. No one ever asked about anything. That was the agreement she'd made with Mercy General: show up, save lives, don't invite questions, and Mercy General would let her fade into the background like just another nurse counting down the hours until retirement. Margaret Walsh had walked away from Coincidental Valley 3 years ago when the nightmares had become the only thing that felt real. The waking hours were the hallucination, the long stretches of nothing, the fluorescent-lit corridors, the patients whose names she forgot by morning because remembering would have meant something. Combat had clarity. Medicine had choices. Choices meant guilt. 3 years of night shifts meant 3 years of not choosing, of letting the protocols make the decisions, of being the person who responded when the machines alarmed and went silent again when the crisis resolved. Gunnery Sergeant Margaret Walsh had walked away and become just Margaret, and just Margaret had become the kind of nurse that residents felt comfortable dismissing, the kind of nurse who could handle a multi-trauma case at 2 in the morning without ever having to explain how she knew what to do before the monitors told her. Her hands had held pressure dressings against wounds that would have bled out anywhere else. Her hands had sutured in the dark. Her hands had learned that pain was information, and information was the only thing between breathing and not breathing. But those hands didn't belong to the night shift nurse. Those hands belonged to someone else. Someone the hospital didn't know. Someone Margaret had promised herself would stay buried beneath scrubs and quiet competence and the kind of invisibility that only comes from having nothing left to lose. The heart monitor's electronic beep changed pitch. 82. 85. The rhythm climbing. Margaret's jaw was set like granite, her eyes fixed on the field of red and tissue, her hands moving with the certainty of someone who'd done this exact thing in a field hospital in Loga province with a generator powering the surgical lights and the sound of .50 caliber machine guns rattling the walls. The attending resident started to move toward her and stopped. Something in her posture stopped him. Something in the absolute certainty of her movements. She was closing the pericardium now, sutures placed with mechanical precision, tiny knots, each one tied with the kind of tension that only came from muscle memory. 90. The blood pressure climbing. Sinus rhythm. The monitor showing the electrical pattern of a beating heart, a pattern that had flatlined for minutes ago. Margaret tied off the last suture and stepped back. Her breathing hadn't changed. Her hands weren't shaking. She reached for a sponge and started clearing the field with the economical movements of someone who'd done this exact procedure in tents where the emergency was that the building was actively burning. One of the residents made a small sound, something between a gasp and a word that didn't come out. Margaret ignored him. She was already checking the closure, already verifying that the work was done correctly, already thinking 3 steps ahead to what came next. Antibiotics. Blood panels. Imaging to verify no secondary injuries. The kind of thinking that kept people alive instead of dead, the kind of thinking that belonged to a gunnery sergeant, not a night shift RN. The attending resident's phone was in his hand. She didn't need to ask what he was doing. He was calling the chief of surgery. Of course he was. What else could you do when you watched someone open a chest cavity and save a life with their bare hands? The on-call surgeon arrived to find the patient already closed, already stable, already recovering from a procedure that shouldn't have worked in a hospital, shouldn't have worked without blood banks and imaging and the full weight of institutional medicine backing it up. But Margaret had already been walking toward the door by the time the surgeon's shoe squeaked against the tile. She'd already stripped her gloves. She'd already filed the charts with entries that said nothing about how she'd done it, only that the intervention was successful, that the patient was stable, that the procedure was completed at 20-27 hours. The surgeon read the chart and read the patient's vitals and read the closed chest with its neat surgical closure and made the calculation that a nurse had just saved a life in a way that defied explanation. He would be smart enough to never ask for one. Competence like that was dangerous to examine too closely. It raised questions. Questions meant paperwork. Paperwork meant accountability. The surgeon made a note that the patient's wound placement indicated a trajectory inconsistent with a documented shrapnel pattern, which meant either the original assessment had been wrong or someone in this room had medical knowledge that exceeded their official credentials by several significant degrees. The break room was empty at 3:47 in the morning. Margaret touched the folded flag once, a motion so practiced it took no conscious thought. The silver thread caught the fluorescent light. 16 names. She knew every one. She knew how each of them had died. She knew the exact moment the knowledge had become unbearable. She'd chosen the night shift, the invisibility, the quiet competence of being overlooked. Mercy General had accepted her terms without ever knowing what the terms were. 3 years of transaction, show up, save lives, don't ask questions, don't be asked any questions. The bargain had held until the night someone stopped her in the hallway. That someone's name was Dr. Marcus Mercer, the new chief of surgery, the kind of doctor who'd made his reputation on television shows and corporate presentations and the kind of confidence that came from never having been tested by anything that couldn't be solved with an administrator's phone call. He was standing in the observation window of Trauma Bay for when she came out at 4:15 in the morning. He'd watched the entire procedure. His jaw was tight. His eyes were very still. He stepped into her path as she moved toward the charting station, and his voice was the voice of someone who'd just realized something that disturbed him on a cellular level. "Your protocols," he said. "I'd like to review your protocols, Nurse Walsh. Some of your confidence concerns me." The sentence hung in the fluorescent-lit corridor like a threat. Margaret met his eyes with a flat stare that had made captains uncomfortable and had made privates stand at attention without any order being given. She nodded once, a motion that could have meant anything. Then she returned to her charting, and Mercer didn't break eye contact first. She did, dismissing him by the simple act of looking away, of returning her attention to the work that mattered. The fluorescent lights hummed on. The machines beeped their electronic song. And somewhere in a hospital room down the hall, a man who should have been dead for minutes ago was breathing with lungs that belonged to him, with a heart that beat because someone had remembered how to save lives when it mattered. That was enough. That would have to be enough. The morning rounds at Mercy General began at 7:30 sharp, and Dr. Mercer moved through the ICU like a man conducting a symphony designed specifically to humiliate Margaret Walsh. 15 doctors and nurses trailed behind him in their white coats and surgical blues, a constellation of authority that he wielded like a weapon. Margaret stood at the foot of a patient's bed, a 53-year-old man named Patterson with a stab wound that had missed his heart by 3 centimeters, and she'd flagged his falling platelet count on the chart an hour ago, the kind of small detail that meant something was wrong inside, something that couldn't be seen yet but would scream if you waited. Mercer stopped in front of the bed and looked at her directly. His eyes had the glint of a man who'd been waiting for this moment. "Nurse Walsh," he said, his voice soft enough that everyone leaned in to hear it, "since you seem so confident in trauma situations, perhaps you can explain the 17-step protocol for emergency thoracotomy in non-surgical settings. Walk me through it." For the staff. The room's air pressure changed. She felt it the way soldiers feel the moment before incoming rounds start screaming overhead. Margaret met his gaze with the flat, even expression she'd perfected over 3 years of being invisible. She didn't hesitate. She didn't clear her throat. Her voice came out steady as a metronome, primary incision at the 5th intercostal space, left anterolateral approach. Identify the pericardium. Incise carefully to avoid coronary artery ligation. Direct cardiac massage. Assess for cardiac tamponade. If present, blood evacuation before closure. Vessel clamping if hemorrhage is identified. 2-inch mattress sutures for closure. Sterile dressing protocol. Tetanus status verification. Broad-spectrum antibiotics within 30 minutes. Serial chest X-rays to rule out pneumothorax. Ongoing perfusion assessment. That's 16. The 17th is documentation within the medical record. She paused. She could have added that the protocol had changed in 2019 when Johns Hopkins published a meta-analysis showing that direct massage was more effective than the open chest method in field conditions, but she didn't. She simply waited. Mercer's smile didn't change. It was the smile of a man who'd prepared a trap and she'd just walked straight through it. "Wrong," he said. His voice had the quality of something sharp sliding across a whetstone. "You missed step 9. This is why nurses need to stay in their lane. You're trained to assist, not to diagnose or determine protocol. You follow the surgeon's lead. You don't second-guess established procedure." He turned back to the staff, gesturing as if he'd just concluded a teaching moment. The residents scribbled notes. 2 of the younger nurses exchanged glances, not of sympathy, Margaret knew, but of relief. Better her than them. The silence in the ICU was so dense you could operate in it. Mercer had rewritten the protocol on the spot. There was no step 9 in the order he'd mentioned. Margaret had recited the protocol exactly as the American College of Surgeons taught it, exactly as she'd used it when mortars were landing 50 meters from the surgical tent and a 19-year-old Marine with his chest cavity flooded with blood was waiting for someone to save his life. But contradicting him in front of 15 doctors meant confrontation. Meant attention. Meant breaking the code of the invisible. She simply nodded, looked down at Patterson's chart, and made a note about the platelet count declining further. The rounds moved on. 2 weeks of this. 2 weeks of calculated strikes designed to crack her composure in public, each one a little harder, a little more personal. By the time she approached her locker on the night shift, she'd been running on muscle memory and 4 hours of sleep across 48 hours. The locker was old, industrial grey, with a small dent she'd never bothered to repair. She opened it at 11:47 p.m., alone in the break room. The words hit her before anything else, Combat Barbie, scrawled in permanent marker across the inside of the door in letters that looked deliberate, methodical. Beneath it, someone had drawn a crude figure, a stick soldier with exaggerated burn marks up both arms, standing next to what looked like a doll. Her hand froze on the door handle. The break room smelled like stale coffee and the kind of fluorescent light sterility that made her teeth ache. She didn't move. She didn't blink. She simply reached down to the bottom shelf of the locker where she kept a locked box, the only box, and opened it with the key she wore on her scrubbed necklace. Inside was a folded flag. American. 13 folds arranged in a triangle, the red and white stripes perfectly crisp, the blue field folded inward like a secret. It had been folded by a chaplain's hands at a memorial service in Kandahar province on a day that had tasted like copper and diesel exhaust. She pulled the flag free and stood in the hallway outside the break room, holding it against her chest, staring at the scrawled words visible through the open locker door. 2 nurses rounded the corner from the supply room and stopped walking. The silence lasted exactly 3 seconds. One of them whispered something to the other. They moved past her without making eye contact. Margaret didn't lower the flag. She didn't speak. The names written inside the folds of that flag, 16 of them, each one a person she'd worked beside, trained with, trusted with her life, those names felt heavier than they had in a long time. She'd chosen the night shift specifically to avoid situations like this, to stay below the waterline where no one asked questions and no one needed to know who she'd been before she became just a nurse. But someone had written Combat Barbie across her locker, and that meant they knew something. Not everything. But something. She carefully refolded the flag and returned it to the box. She didn't look at herself in the mirror. She just walked back to the unit and clocked into her shift. The elevator confrontation came on a Tuesday at the end of the second week, 3 minutes after Margaret had completed the medication log for the night shift and was heading toward the exit. Dr. Mercer stood in the hallway near the elevator bank, and when he saw her approach, he stepped directly into the doors just as they opened, blocking her path with his forearm. The gesture was deliberate. His face was the color of old brick. "Let me be clear about your place here, Walsh." His voice was quiet enough that only she could hear it, the kind of quiet that comes just before someone does something they'll regret. "You're a night shift nurse. You don't make surgical decisions. You don't question my orders in front of residents. You certainly don't perform procedures above your pay grade. You assist. You document. You follow protocol. That's your lane. Stay in it. Do you understand me?" She listened with the cold, flat stare she'd perfected over 12 years in places where flinching could cost lives. Her hands were steady. Her breathing was steady. Every part of her was absolutely still, the way a predator holds still before moving. When he finished, when he'd run out of words and was waiting for her to flinch or apologize or show some small crack in her composure that he could exploit, she spoke. Her voice came out like an instrument tuned to a frequency that made something in the air vibrate differently. "I've closed wounds in men twice your size while mortars landed outside the tent. Men with shrapnel in their chests and fear in their eyes and lives that depended on someone knowing exactly what to do in the dark. Your insecurity doesn't even register as a threat." She stepped around his arm, not pushing past him, just moving with such absolute certainty that he instinctively lowered it. The elevator door slid shut behind her. She didn't turn back. His face went crimson. The kind of red that blooms when someone's realized they've been outmaneuvered by someone they thought was beneath them. Margaret didn't wait for the next elevator. She took the stairs, her footsteps echoing off the concrete in a steady rhythm that matched her heartbeat, slow, measured, unaffected. By the time she reached the parking lot, she knew what would happen next. She delivered a threat wrapped in calm. A man like Mercer didn't absorb that kind of challenge without responding. He would build something. Documentation. A paper trail thick enough to hang someone from. She'd just given him the justification he needed to do what he'd probably wanted to do from the moment he'd walked into Mercy General and found a night shift nurse who knew too much about how to save lives in impossible situations. She sat in her car for 20 minutes before driving home, and she didn't turn on the radio. She just listened to the rain starting to fall, the kind of rain that comes in Georgia in late spring, heavy and relentless and without mercy. By midnight, Mercer had already sent the first email, copied to hospital administration, flagging her for scope of practice concerns and autonomous decision-making above nursing credentials. The paper trail was opening like a mouth ready to swallow her whole. The next morning, she noticed the reassignments. A patient flagged for septic shock, a woman with a fever and falling blood pressure, was transferred to a less experienced nurse's station without explanation. Margaret had flagged the deterioration yesterday. The patient crashed 2 hours after the reassignment. The attending physician called it a complication. No one mentioned that she'd flagged it first. Mercer sent another email. Nurse Walsh's assessment was inaccurate and alarmist. This is precisely why protocol exists. But that wasn't the real crisis. That wasn't what made her hand tremble for the first time in 3 years. When she walked past room 347 and saw the name on the intake board, something in her chest did something that felt like breaking. Corporal Hayes. Delta Force Medic. Coincidental Valley. The room number was like a combination lock clicking into place, all the numbers aligning, all the safety switches falling away. She'd known him. Not known him in the way civilians know each other, but known him the way soldiers know each other. She'd treated wounded men alongside him. She'd watched him work under fire with the steady, urgent precision of someone who'd chosen to save lives even when dying would have been easier. She avoided his room for 6 hours. She moved through her other duties with mechanical efficiency, hanging fours, checking monitors, documenting vitals, everything but stepping foot in room 347. But avoidance wasn't sustainable. At 2 in the morning, she finally entered. Hayes was awake, his left shoulder wrapped and elevated, his face the color of worn canvas. His eyes found her immediately, and something flickered behind them, recognition, maybe, or just the muscle memory of survival. His voice came out hoarse and quiet. "Hey, matching set. Where'd you get yours?" He was looking at her scars, the burn marks that ran up both her forearms like signatures of a life that belonged to someone else. She didn't answer. She just hung before and turned to leave. But later, alone at the charting station with his medical record open, she saw something that stopped everything. The shrapnel trajectory documentation didn't match the entry wound. She'd seen the wound when they brought him in, right lateral chest wall, deep, precise. The chart showed a wound path that would have missed the major pulmonary artery. That was wrong. She'd closed enough wounds in men who were bleeding out to know the difference between a chart that was correct and a chart that could kill you by treating the wrong thing. She flagged it to the attending physician. He glanced at it and said, "Charts from the trauma surgeon. I'm not going to second-guess the note." She flagged it to Mercer. He added it to his growing file that Nurse Walsh continues to contradict physician assessments without appropriate credentials. The room around her felt like it was collapsing into something smaller. Hayes was in danger. The chart was wrong. And no one was listening to the person who knew. The chart was wrong. And no one was listening to the person who knew. Margaret had flagged the discrepancy on Corporal Hayes's intake 3 days ago, a neat, professional note in the system, shrapnel entry trajectory inconsistent with documented wound location. Recommend cardiothoracic consultation. Suggest pericardial imaging. The flag sat in the digital file like a stone dropped into still water, sending out ripples that no one acknowledged. Dr. Mercer had already begun his campaign by then. It started small. A reassignment. Margaret was prepping for a 4-hour shift managing the post-op recovery bay when the charge nurse, Diane, appeared at her station with that apologetic pinch between her eyebrows that meant bad news was coming. "Mercer needs you in ICU rotation tonight," Diane said quietly. He's moving you off Hayes's case. Says we need better distribution of experienced staff. Margaret had nodded without argument, without the anger that would have been justified. The reassignment made no logical sense. Hayes was stable, his monitoring routine, and Margaret had already built the clinical narrative of his recovery. But she'd simply clocked out of the post-op bay and clocked into intensive care, where she managed 3 other patients with a competence that earned her exactly 0 acknowledgement because Mercer had already assigned her to patients who didn't matter enough for him to watch. The pattern accelerated. Mid-shift transfers became her routine. On Tuesday, a trauma admission, 17-year-old with a stab wound to the flank, Margaret's specialty, her hands steady as they'd been in Corangal Valley when she'd taught younger soldiers how to pack a wound without panicking, was transferred to another nurse before Margaret finished the initial assessment. Protocol concern, the text read. On Wednesday, a post-op bleed that Margaret had caught early, a patient whose life depended on her catching the subtle shift in urine output that signaled internal hemorrhage, was transferred to a day-shift nurse with half Margaret's experience. The attending surgeon had trusted Margaret's call. Mercer had overridden it. By Friday, Margaret understood the architecture of what he was building. Each reassignment was documented. Each transfer had a paper trail showing Margaret's limitations in complex cases. He was constructing a narrative. 1 transfer looks like logistics. 3 looks like distribution. 10 looks like a pattern. 10 looks like incompetence. The public humiliations began during morning rounds. Mercer would stand at the foot of a patient's bed, tablet in hand, and ask Margaret to present the case. She'd give her report, vitals, labs, assessment, plan, with the precision of someone who'd communicated medical information under circumstances where imprecision meant death. Mercer would listen, nod, and then say something that made the residents and interns exchange glances. Actually, I think we should increase the diuretics instead, he said on a cardiac patient where Margaret had recommended cautious fluid restriction given the patient's failing ejection fraction. Nurse Walsh seems to be overthinking this. The patient was his, not Margaret's, but the implication was clear, she wasn't thinking at all. On another case, a post-op orthopedic patient running a low-grade fever 3 days out from surgery, Margaret noted the fever pattern was consistent with a hematoma rather than active infection, wound looked clean, labs were stable, inflammatory markers minimal. We should avoid empiric antibiotics and monitor, she'd said. Mercer had ordered the antibiotics anyway, turning to the resident and saying, you can't be too careful with infection. Some people have a tendency toward false confidence. The words were soft. The damage was precise. By the 3rd round, Margaret stopped offering assessments. She gave facts. Temperature. Heart rate. Oxygen saturation. Urine output. Let Mercer interpret. It didn't matter. The damage was already done. The narrative was set. Margaret Walsh was a competent technician with dangerous gaps in judgment. The staff meetings were orchestrated theatre. Dr. Mercer began scheduling them specifically on nights when Margaret was working, which should have been impossible but somehow wasn't because he was chief of surgery and the schedule bent to his will. He'd stand at the front of the conference room in the hospital's east wing, fluorescent lights casting everyone in the same institutional pallor, and he'd announce the topic casually. Let's discuss obscure protocols today. Keeps us sharp. Margaret would feel 30 pairs of eyes adjust their angle, suddenly aware of her presence in a way they hadn't been 5 seconds before. The ACLS guidelines for pediatric resuscitation updated in 2020, Mercer would say, looking directly at her. Can anyone tell me the epinephrine dosing for a 7-year-old in cardiac arrest? Margaret knew it. 0.01 milligrams per kilogram intravenously, maximum single dose of 1 milligram. But raising her hand meant speaking. Speaking meant visibility. She sat silent while a junior resident fumbled through an answer that was close but wrong. Mercer nodded. Anyone else? Surely someone here knows. Margaret had walked into a foxhole in Kandahar province where a child, couldn't have been more than 6, had taken shrapnel from an IED, and she'd calculated that dosing in her head while her hands were moving, while the rounds were snapping past overhead, while her squad leader was yelling coordinates into the radio. She'd run through the math in the space between her first breath and her second. The child had survived because the dosing was exact. She raised her hand. Nurse Walsh. Go ahead. 0.01 milligrams per kilogram. Max dose 1 milligram. Her voice was flat. Correct. Meaningless. Well, technically, Mercer had said, and then spent 4 minutes explaining why her answer, though numerically accurate, reflected a dangerous oversimplification of pediatric resuscitation protocols and lacked the nuanced understanding that separated a real clinician from someone who'd memorized a guideline. He'd smiled when he said it. The residents had looked away. The cumulative effect was the goal, Margaret understood. Not one incident that would warrant an HR complaint or union involvement, but 1,000 small moments of undermining, each one deniable in isolation, each one trivial on its own, but together forming a cathedral of doubt about her competence, her judgment, her presence at Mercy General. And underneath it all, Hayes's chart remained flagged. His imaging continued to show what Margaret had seen from the beginning, shrapnel positioned like a loaded gun against his pericardium, the membrane surrounding his heart. A trauma surgeon would have caught it immediately. An experienced cardiologist would have recommended protective measures. But Mercer had noted Hayes's case as a minor trauma, routine recovery, and Margaret's flagged recommendation had been filed away like a document in a dead language. It was 2:04 a.m. on a Tuesday when the alarms began. Margaret was 3 patient rooms away, checking vitals on a post-op surgical patient, when the monitor's scream cut through the quiet of the night floor, that primal electronic wail that stops time. Code. Cardiac compromise. Severe. She was moving before her conscious mind registered which room, muscle memory from 1,000 emergency calls in another life, her feet already eating the distance down the hallway. Hayes's room. Of course it was Hayes. The attending resident, a young man named Peterson who'd been through a dozen emergency scenarios in training but never one that mattered, stood frozen at the bedside, mouth open, eyes locked on the monitor where numbers were deteriorating in real time. Blood pressure dropping. 70/40. Falling. 60/30. Peripheral pulses absent. Oxygen saturation declining. The monitor showed a rhythm but the patient showed nothing, no perfusion, no consciousness, just a body shutting down. "Get me a thoracotomy tray," Margaret said. Her voice came from somewhere older than her civilian life, somewhere that had never asked permission to save lives. Peterson's head turned toward her. "The on-call surgeon is coming. He's 20 minutes out. We wait for. He has 5 minutes." Margaret was already moving, accessing the rapid response cart, her hand selecting equipment without conscious thought. 14-gauge angiocath. She had to establish a line now, while there was still any chance of a vein to find. Pressures dropping. No peripheral pulses. He's going into arrest. We need to wait for Dr. Mercer's authorization. The door opened. Mercer was there, sleep-rumpled, phone already in his hand, already recording this moment, already building whatever narrative he would construct. His eyes moved from Hayes to Margaret, taking in her position at the bedside, the equipment she was laying out with systematic precision. "Nurse Walsh, step back from that patient." Not a request. Not even urgent. Just a command delivered in the tone of someone accustomed to obedience. "We wait for the attending surgeon." "You are not authorized to." Margaret didn't turn around. She looked at Hayes, unconscious, blood pressure 42/20, no peripheral pulses, no time, and she made a decision that would end her career at Mercy General. "No," she said. The word landed like a physical object. Peterson's breath caught. A nurse in the hallway, called to help, stopped moving. Mercer's phone lowered 6 inches. "I'm sorry." Mercer's voice had taken on that quality it got when he was being disrespected, thin and dangerous and controlled. "Thoracotomy tray." "Now," Margaret said, and her tone wasn't a request either. It was a command issued by someone who had commanded soldiers, who had made life-and-death decisions in circumstances where hesitation meant bodies, who had carried the weight of keeping people alive when all the conventional answers had failed. Peterson's face had gone pale. "We can't. That's surgery. That's left anterolateral thoracotomy. Between the 5th and 6th ribs." Margaret was already positioning Hayes, turning him, her hands moving with the certainty of muscle memory forged in a tent in Coincidental Valley where she'd done this exact procedure on a Delta Force operator who'd taken a round that the imaging had missed, just like it had missed what was happening inside Hayes's chest right now. "Get me a rib spreader. Surgical scissors. Pericardial clamp." Mercer was talking, his voice rising, something about policy violations and authorization and her ceasing this unauthorized procedure immediately, but Margaret had stepped outside his volume. She existed in a different register now, one where protocols mattered less than outcome, where the hierarchy of a hospital meant nothing compared to the hierarchy of keeping a man alive. The tray arrived. Someone, a respiratory therapist, a nurse from the code team, people whose names she didn't know, had understood that this was happening whether or not anyone had authorized it. The rib spreader went in. Her fingers found the space between ribs, found the path she'd walked before, and she cracked his chest open with the same steady strength she'd used before, in a place where civilians didn't go, where the rules were written by whoever was holding a scalpel and the will to use it. The room went silent except for the monitors and the hiss of air escaping Hayes's thorax. Pericardial sac. There. The membrane was distended, fluid, blood, exactly what she'd flagged on the chart 3 days ago. The shrapnel had migrated. The weapon was loaded. She opened the pericardium with 3 precise cuts and found the source, a fragment the size of a thumbnail, pressed against the wall of his right atrium like a curse. Direct cardiac massage. Her left hand inside his chest cavity, fingers forming a C-shape around his heart, compression against the sternum with her right hand, squeezing that muscle like she was trying to push his life back into his body through sheer force of will. Once. Twice. 3 times. The monitor responded. Sinus rhythm flickered. Faded. She compressed harder. Rhythm returned, and this time it held. Hayes's blood pressure climbed. 80. 90. 100. Oxygen saturation rising. The color of his skin shifted from gray to something approximating human. She kept her hand inside his chest, feeling the heart beating against her palm, that primal confirmation that the procedure had worked. "Closing," she said, and reached for the supplies. The surgeon arrived at 2:23 a.m., took one look at the open chest cavity, at Hayes's stabilizing vitals, at Margaret's hands moving through the closure with surgical precision, and said nothing. Just moved to assist. Professional to professional. The kind of respect that transcends hierarchy. Margaret closed the thoracotomy with absorbable sutures, 6 knots for security, checking the field one final time before she stepped back. Sinus rhythm. Pressure stable. A man alive because she had broken every protocol in the hospital code. When she looked up, Mercer was standing in the corner, phone already out, already typing, already constructing the document trail that would become her termination letter. By 8:06 a.m., he'd filed the incident report. 17 violations. Unauthorized surgery. Practicing medicine without a license. Operating outside her scope. Each charge perfectly calculated, each one technically accurate, each one weaponized against her. By noon, a security guard, the one who'd always nodded respectfully, who'd acknowledged her competence without words, handed her a cardboard box containing her personal effects and a termination letter signed by the hospital administrator. Her folded flag was in that box. The flag from Coincidental Valley. The only physical thing she'd kept from the life where she'd known how to save people without apology. The guard wouldn't meet her eyes as she left. The chest cracked open like a locked door nobody else knew how to breach. Margaret's hands moved on their own, muscle memory written in bone and blood, the kind that doesn't fade just because you change your last name and wear scrubs instead of body armor. The sternal saw screamed. Then silence. Then work. Hands steady as surgical lasers. Fingers inside the thoracic cavity, finding the wounded heart, feeling what the machines couldn't read. Direct cardiac massage. The kind of procedure you learn in a forward aid station in Korengal Valley when the halo is 40 minutes out and a soldier is flatline at your fingertips. Not textbook. Not gentle. Necessary. Her fingers compressed the ventricles in rhythm, manually pushing blood where the organ had quit its job. 72 compressions per minute. Steady. Controlled. The muscle memory of someone who'd done this while mortars landed outside the tent and the generator hummed, and the only thing between life and death was the person willing to crack open a chest. The attending residents didn't move. They watched her hands work like they were watching something that shouldn't be possible. One of them, a fourth year, started to step forward, and Margaret's voice cut through without her eyes leaving the operative field. Stand back. Not a request. A command. The kind that made bone-tired young doctors obey without thinking about why. O2 saturation climbed. 68. 75. 82. The numbers ticked upward on the monitor like someone was manually turning a dial toward survival. Hayes's heart stuttered. Responded. Found its rhythm again. Sinus rhythm, Margaret said quietly. His back. She closed the chest the way someone closes a door they've spent months learning to keep sealed. Methodical. Precise. Each stitch a promise she was making to a man she'd once known in a different life, under a different name, in a place where the only hospital was the one she'd built from sandbags and triage rules written in blood. 47 minutes. That's how long the whole thing took. Hayes's blood pressure normalized. His pupils responded. The ventilator's rhythm steadied. The attending residents were still standing frozen when she stepped back from the table, stripped off her gloves, and walked out of the OR without a word. Dr. Mercer was already on his phone by the time the sun came up. 17 policy violations. An incident report thick enough to build a case. The regulation he found was from 2003, some obscure credentialing language about unauthorized procedures, signed by someone nobody remembered. But it had teeth. It had dates. It had his name on the filing paperwork with timestamps that made it look official, careful, justified. Within 6 hours, he'd called someone, maybe his brother-in-law who worked in hospital administration, maybe someone higher, and built a documentation trail so solid that by noon, a security guard was walking through Mercy General with a cardboard box containing Margaret's locker contents. She didn't argue. She didn't defend herself. She didn't cry. She took the box, nodded at the guard who wouldn't meet her eyes, and walked out to the parking lot where the Savannah heat was already pressing down like a hand on her chest. The termination letter sat on the passenger seat, printed on official letterhead. Effective immediately. Pending investigation. Ineligible for rehire. Her name had been spelled correctly, Margaret Walsh, which somehow made it worse. This wasn't a mistake. This was deliberate. This was Mercer's signature on the line above his title, and it was the final punctuation on 3 years of becoming someone invisible. The folded flag was in her apartment still, wrapped in a cardboard storage box under the bed. The flag from a 19-year-old Marine named Rodriguez who died in her aid station on a Wednesday that never stopped being Wednesday. His sister had sent it after the funeral. Margaret had carried it home from Kandahar like it weighed 1,000 pounds, which it did. She'd folded it the way they'd taught her to fold flags. Crisp triangles. Point in the center. The way Arlington did it. The way they did it when someone mattered and you wanted the world to know. But the flag she'd grabbed this morning was something different. Just a piece of fabric, worn thin from 3 years of being held during the worst nights. She'd taken it from her locker before the guard escorted her out, tucked it under her arm, and now it sat on the passenger seat next to the termination letter like they were married, like they belonged together. The steering wheel was too hot to touch. She sat in the car for 20 minutes in the Mercy General parking lot, hands shaking in a way that had nothing to do with fear and everything to do with knowing that the only thing keeping her alive for the last 3 years was the job, the night shift, the patients who didn't ask questions. The work had been her anchor. The work had been the only reason to show up, the only reason to keep the nightmares at arm's length, the only reason not to end up like half the people she'd served with. The VA hospital in downtown Savannah wasn't 5 miles away. But it felt like traveling into enemy territory. She walked into the waiting room at 6:36 p.m. with the termination letter in one hand and a clipboard in the other. The intake desk gave her a form. A PTSD screening. A psychiatric history checklist. Questions about deployments, about trauma, about whether she'd ever considered hurting herself. She sat in a plastic chair between a Vietnam vet with a prosthetic leg and an older woman who might have been Air Force, might have been Navy, might have been someone else's story entirely. Her hands shook when she filled out the forms. Not from fear. The hand tremor came from something deeper, the realization that she'd lost the job, lost the apartment once the rent couldn't be paid, lost the routine that had been the only thing holding the walls of her mind together. 3 years of stability, and it had taken Mercer's vendetta and one perfect medical call to tear it all open. She'd hidden from her past because the past was a graveyard. She'd chosen anonymity because Margaret Walsh the nurse was someone who could function. Gunnery Sergeant Margaret Walsh was someone who could break, and breaking was a luxury reserved for people with health insurance and time for therapy. A former Marine 2 seats down kept staring at her scarred forearms. The burn marks were visible, always visible. He was trying to place her. Trying to remember where he'd seen those hands, those scars, that particular way of sitting that came from learning to take up no space when space was a threat. He opened his mouth twice. Closed it both times. Maybe he knew. Maybe he was just one more person seeing what Margaret had spent 3 years hiding and finding it impossible to unsee. She finished the intake forms at 7:34 p.m. with the checkbox marked PTSD, suicidal ideation, no current plan but persistent intrusive thoughts. The truth, written in clinical language. The evidence that she was drowning and had been drowning the whole time. Back at Mercy General, Hayes woke in the ICU with his chest wrapped in gauze and a tube down his throat. The heart monitor beeped its steady rhythm. Machines calculated his blood pressure, his oxygen saturation, his core temperature. A second-year resident stood at the foot of the bed, reviewing his chart. What happened? Hayes tried to speak and couldn't get past the ventilator tube. The resident checked his tablet. Emergency thoracotomy at 0204 hours. You arrested. No peripheral pulses. Someone cracked your chest and brought you back. Direct cardiac massage. The resident's voice carried the tone of someone reading something they didn't fully believe. You've been sedated for 12 hours. Hayes's eyes widened. His heart rate jumped. The monitor spiked. The resident moved to increase his sedation, but Hayes pushed the attending nurse away hard enough to register on the alarm. He grabbed the resident's arm with one hand, his other hand gesturing frantically at the chart. Who? His voice came out as a rasp past the tube. Who did it? The resident scrolled. Found the termination notice filed that morning, which included the name in the statement. Found the timestamp. Found the record that Mercy General had officially erased her from the building. Margaret Walsh. The resident said it carefully, the way you say names of people who've done the impossible. There was an incident report. She's gone. Fired by noon. But yeah. She's the one who saved your life. Hayes's face went the color of hospital sheets. His hands gripped the bedside rail so hard the metal bent inward from the pressure. That's impossible, he whispered. That's impossible. Gunnery Sergeant Walsh disappeared 3 years ago. She was in Coincidental. She was in the valley. She was... He stopped. He knew exactly where she was, because he'd seen her hands, her face, her scars in that moment before the anesthesia took him. She'd been standing over him the whole time. Saving him. Using skills she should have buried. You know her? The resident asked. Hayes didn't answer. He just closed his eyes and tried to breathe past the ventilator tube while his chest wound screamed and his heart remembered what it meant to be brought back from nothing. The next morning, a man in a borrowed hospital wheelchair rolled through the automatic doors of Mercy General's East Corridor, his skin still grey from surgery, his left arm wrapped tight against bandaged ribs. A State Department translator walked beside him, speaking Pashto into a phone. The man's eyes swept the hallway until they found her, Margaret, standing at her locker with her name badge already in her pocket, folding her last personal item into a canvas bag. Her hand stopped. She turned. The man's face went white, the same white as blood draining from a patient's face when shock sets in. In broken English, each word landing like a stone into still water, he said, "You are the angel of Coincidental. You saved my brother when your command said leave him." The fluorescent lights buzzed overhead. Margaret didn't move. The translator was already calling for a nurse supervisor. Within 30 seconds, staff members began appearing in the hallway, drawn by the sound of a refugee patient's voice trembling with recognition. Corporal Hayes pushed his footpole through the crowd like he was parting a sea. The catheter in his arm caught the light, swaying. His chest wound still wept through fresh gauze beneath his hospital gown. His legs could barely support him. The cardiac massage Margaret had performed had cracked 2 ribs, the impact necessary to keep him breathing, but he moved anyway, his voice cutting through the murmur of confused staff. Her real name is Gunnery Sergeant Margaret Walsh. He didn't shout it. He said it the way you state a fact in court. The way you give testimony. The room went dead silent. Margaret's jaw tightened. Not from fear. From the weight of something she'd buried for 3 years now surfacing in front of 37 people she worked with, all of them staring at the burned scars on her forearms like they were suddenly writing a different story. The hospital chaplain, a man named Father Holloway, retired Navy, 22 years as a corpsman before the collar, was already moving to a nearby computer terminal. His fingers flew across the keyboard with the precision of someone who'd once worked in triage. He pulled up a screen. Then another. His face shifted the way a soldier's face shifts when reading a letter from someone who didn't come home. Father Holloway's voice was soft, the kind of soft that carries weight because it doesn't need volume. Silver Star. A pause. Staff members gasped. 2 purple hearts. Another pause. The chaplain's eyes found Margaret across the hallway, and something in his expression, something that understood what it meant to carry scars that didn't show on skin, hardened into something fierce. Both in the same deployment. Coincidental Valley, Cunha Province. She was with 3rd Battalion, 5th Marines. The whispers started. Margaret could feel them like static electricity, that moment before lightning strikes when the air pressure changes and you know something is about to break open. A woman in scrubs, a resident named Chen who'd watched Margaret perform that impossible thoracotomy at 2 a.m., was shaking her head slowly, putting pieces together. That's why she knew exactly where the shrapnel was lodged, Chen whispered. Field experience. The chaplain wasn't finished. He was reading from his screen now, his voice taking on the cadence of someone delivering difficult truths, saved 43 Marines in 9 months. 43. The number hung in the air like something that refused to be quiet. The doors to the administrative wing hissed open. A man emerged in a wheelchair, a Delta Force colonel named Marcus Webb, 71 years old, with a face carved from a life spent making decisions that killed people or saved them, and the weight of both kinds of choices visible in the lines around his eyes. He was here for a routine surgical consult, a follow-up on an old injury that would never quite heal. He stopped his wheelchair in the middle of the hallway, and his presence alone seemed to pull the oxygen out of the air, the kind of calm that comes from having already survived the worst, that comes from knowing exactly what you're capable of and what the cost is. His eyes went to Margaret's forearms first, catching the scars. Then to her neck, where a small piece of a tattoo was visible beneath her collar. His hand moved to his collar and pulled it back just enough to show identical ink beneath, a stylized mountain range with 16 names etched into it. Coincidental Valley Memorial. He stared at Margaret. Then he spoke, his voice the color of gravel. I know that tattoo. I wrote 3 of those condolence letters myself. He didn't ask permission. He simply pulled out his phone and began making calls. The administrator. The hospital legal team. The hospital board. His voice never raised. That made it worse. Her citations. I'm reading her citations. Silver Star. Purple Heart, first. Purple Heart, second. Still want to know why she's standing here with a termination letter in her pocket. The administrator arrived within 4 minutes. A woman named Patricia Kowalski, 30 years managing hospital operations, who'd never fired a decorated combat veteran before but also had never had a Delta Force colonel make calls that reached the Joint Commission office. Mercer came with her, already defensive, his hands moving in explanatory gestures that meant nothing. This is exactly why I filed the reports, he was saying. She was working under false credentials, performing procedures without proper authorization. The entire protocol was, the administrator cut him off. Her voice was surgical, her nursing credentials are fully valid. You fired a decorated combat veteran for saving a patient's life using skills she learned in a war zone. Mercer's face flushed. He tried again. The incident report clearly documents 17 policy violations. The credentialing issue is documented. I have evidence of her. The administrator didn't listen. She simply turned to the colonel and said, "Come with me," and they walked into a conference room with glass walls. The entire hallway watched. Within the next 30 minutes, a nurse named Rodriguez came forward. Dr. Mercer changed the protocol he quizzed her on during rounds, she said to the administrator, now sitting with legal and compliance. I have emails. He rewrote it after she answered correctly, then presented the new version as if she'd failed the original. Another nurse, he reassigned her 3 times after she flagged complications. 2 of those patients crashed within 6 hours. She was right about all of them. The refugee patient's translator provided a statement. Hayes provided a written account, his hands shaking slightly as he held the pen, but his words steady as ground truth. The colonel made additional calls. By noon, a complaint had been filed with the Joint Commission. By 2 p.m., Dr. Mercer was placed on administrative leave pending investigation into creating a hostile work environment. By 3:15 p.m., security arrived at his office with a cardboard box. The guard's name was Thompson. He'd been the one to escort Margaret out that morning. Now he was walking beside Dr. Mercer, and his presence in the hallway made something clear: this wasn't happening in private. This was happening where people could see it. Where Margaret could see it, if she was still here. And she was. She was sitting in the break room with her folded flag on the table in front of her, the way some people carry rosaries or talismans, and she watched through the glass partition as Thompson handed Mercer a cardboard box with his personal belongings. I believe you know the way out, Thompson said, and the words were exactly the ones Mercer had used with Margaret. The parallelism was deliberate. Mercer's face went white. He looked like a man discovering that the ground beneath him had been removed, that every step backward had been leading him toward a fall he didn't see coming until he was already falling. He didn't argue. He just took the box and began walking toward the elevator, his movements the gait of someone in shock. He passed the break room where Margaret sat today. His eyes did not meet hers. Her eyes did not look away. The silence between them was so thick you could operate in it. 6 months later, someone mailed Margaret a photograph. She was standing in her new office, trauma coordinator, Mercy General, the hospital having quietly decided they needed someone who understood the bridge between field medicine and civilian emergency care when the envelope arrived in interoffice mail. The photograph showed Dr. Mercer in scrubs at a clinic called Quick Care Solutions. The sign behind him advertised urgent care, flu shots, and minor lacerations. To the left of the clinic was a vape shop with neon signage. To the right was a tax preparation service. Strip mall. Savannah's commercial district, Route 17, the kind of place where careers went to disappear. Margaret held the photograph for a long moment. She didn't feel anger. She didn't feel satisfaction. She felt the weight of something closing, the way a circle completes itself. She folded the photograph carefully, and then she walked to her desk and retrieved the folded flag, the one she'd carried from Coringal Valley 3 years ago, the one she'd been holding in her hands when Hayes woke up and when Thompson escorted her out. She opened the triangle fold gently. Inside were the 16 names. The ones who didn't come home. The ones who'd taught her that some things matter more than being comfortable. She tucked the photograph into the fold beside them, closed the flag, and set it on the corner of her desk where she could see it every day. Subscribe for more stories of hidden strength revealed. Like this video if you believe the quietest people are often the most dangerous. Comment below, have you ever been underestimated by someone who had no idea who they were standing next to? And tell me, do you think his punishment was enough, or did he deserve worse?